this guide, we will explore how to determine how many weeks pregnant you are. Knowing this information can be crucial for your health and future choices. If you are considering an abortion, understanding your pregnancy length is especially important because it helps ensure you receive the safest and most effective care. Many people don't realize how easy it can be to figure out your pregnancy date using simple methods. Understanding how far along you are is vital, as it can influence your options when making decisions like abortion. For instance, medication abortions are most effective when you are under 13 weeks pregnant. Knowing your pregnancy duration also helps ensure that you receive the right care at the right time. Pregnancy length also impacts both medical and legal decisions. Different laws may depend on how many weeks pregnant you are, and healthcare providers need to know the exact week to keep you safe. Having this information reduces unnecessary risks and ensures proper treatment. However, determining the exact week is not always essential in every case. In many situations, abortion can be successfully performed without knowing the exact week, as long as you're within the first 13 weeks of pregnancy. The key is to estimate as accurately as possible and consult with healthcare providers if needed. There are some common challenges in tracking pregnancy weeks. If your menstrual cycle is irregular, it can be difficult to accurately determine your pregnancy age by counting days. Many women forget the exact date of their last period, or their cycles may have changed. Additionally, pregnancy can vary from woman to woman, with some experiencing faster or slower development, which can make dating less precise but still manageable. To calculate your pregnancy weeks using a calendar, start by recalling the start date of your last period. Try to remember the exact day you first noticed bleeding, and if possible, write down that date. Mark this date on your calendar. After that, count the weeks from that date to today. For example, if your last period started on September 13th, begin counting the weeks from that date. If you're unsure or need confirmation, using pregnancy tracking apps or visiting a healthcare provider can offer more accurate guidance. In uncertain cases, ultrasound testing can also help determine your pregnancy duration more precisely, especially if you have irregular cycles or missed periods. It's important to note that most early medication abortions are safe if you are under 13 weeks pregnant. You don't need to know the exact week, just an estimate that you are within the safe window. However, if the pregnancy duration is estimated incorrectly, it could increase the risks during procedures, so it's always best to consult with a healthcare provider if you are unsure. When planning for an abortion, it's essential to understand the legal and medical guidelines in your area, as laws regarding abortion may depend on the stage of pregnancy. Be sure to have your medical history ready, including your last menstrual period date if you know it, and choose a trusted healthcare provider. In conclusion, estimating how many weeks pregnant you are is a simple but important step in managing your pregnancy. Anyone can use a calendar to count the days from their last period. There's no need for perfect pregnancy dating for medication abortions to be safe. If you're unsure or need further clarification, don't hesitate to visit a healthcare provider. Knowing your pregnancy stage helps you make informed and safe choices. Your health and well-being come first.